Okay, what I'd like to do now is to review some of the major structures of the skull. The skull has two main portions of it, the cranial bones and the facial bones. Cranial bones are simple, they're large, and they provide the major portion of the skull. The most prominent one anteriorly is the frontal bone. The frontal bone moves posteriorly and meets two paired parietal bones. And those paired structures, and you can see the parietal bones meeting at the suture, this sagittal crest right here. There's a parietal bone on the right, there's a parietal bone on the left, and those two bones meet at the occipital bone. The occipital bone meets where they end. That line right here is called a suture. As you know, the suture is called the lambdoidal suture. Where each of the parietal bones meet, and the superior portion of that is called the sagittal suture. And then rotating a little bit more, where the parietal bones meet to the frontal bone, that's called the frontal suture. Let's go in a little bit closer to the skull. We're going to identify some more bones here. So the next to, adjacent to the parietal and occipital bones, you have the temporal bone. Moving anteriorly, you have the sphenoid bone. The sphenoid bone is a very complicated bone in the skull. The zygomatic bone is the major portion of the external portion of the cheek, and I'll get to that in a second. The maxilla provides the roof of the mouth and the upper lip, and then the lower jaw is the mandible. Getting back to the temporal bone has a couple of major structures that are important. There's this circular hole right here called the external acoustic meatus. That canal or meatus provides a passageway for the nerves and blood vessels to move from the external portion of the ear into the brain. Then I'm outlining this process of the temporal bone. That process of the temporal bone, that yellow structure right here, is a process that's on the temporal bone, but it's called the zygomatic process of the temporal bone. This structure right here, this bone, is the zygomatic bone. And it has a process. That process, or this portion that sticks out right here that I'm outlining, is the temporal process of the zygomatic bone. The combination of those two processes, the temporal process of the zygomatic bone and the zygomatic process of the temporal bone, the combination of those two, it produces the zygomatic arch. So let's rotate the skull some more. Now go head on here. I'm going to pull out a little bit here. So again, the major bones of the skull in terms of the face, the mandible, the maxilla, in the center portion of the skull, lateral portions of the zygomatic bone, and then the frontal bone. Drawing your attention to the nose. There's a couple of major structures here in the nose. Superior to the nose, there's the nasal bone. The nasal bone, as I'm outlining here, this is a very small bone, and it connects directly to nasal cartilage that then produces the major prominence of the nose. Internal to that is the ethmoid bone, and I'll bring up the ethmoid bone in a minute. And inferior to that is the vomer. The vomer, let's see here, is right there. And I'm trying to get a couple other bones here, but they're not showing up. The other major bones of the nose include the palatine bone, and I can't get that popping up here. Okay, let's move over to the eye. The eye has some major bones associated with it. The frontal bone provides a superior portion of the eye. The lateral portion of the eye is the zygomatic bone. The medial portion of the eye is the maxilla. Now, if you look in the back where my mouse is pointing, that bone right here is called the sphenoid bone. The sphenoid bone then medially attaches to the ethmoid. That's the second time that we've seen the ethmoid bone. And then anterior to that is the lacrimal bone. The lacrimal bone in the eye is very, very small, and it's associated with the tear ducts. want to go back to the posterior portion of the eye, where you have three main parts to it, and they're all associated with the sphenoid bone. The sphenoid bone has a fissure or a major crack in it, and that major crack that is superior is called the superior orbital fissure. There's also an inferior crack that I'm outlining right here. It's an inferior orbital fissure. And then between the inferior and the superior orbital fissures, you have this circular hole or canal called the optic canal, the optic foramen. Okay, so I think I'm going to stop here and continue later on another topic.